All right. Hi, everyone. My name is Nick Zupan. I'm the epidemiologist with the Rock County Public Health Department. Welcome to another segment of Numbers with Nick today. We're going to be talking through some topics related to data quality and data reporting. So without further ado, I'm just going to jump into today's content. If you have any questions, feel free to put those in the chat box and we'll try to answer those at the end of the video today. You can always send us questions via social media after the conclusion of today's segment. But with that, the case numbers are looking pretty good right now. On average, we're seeing about 12 new cases per day over the last week, and that has come down. It continues to fall in terms of our case activity in Rock County, which is good news. As of yesterday afternoon, we have an official total of 14,532 Rock County residents testing positive for COVID-19. And that's a sizable number, but a lot of people have recovered from their illness. We're looking at about 169 active cases based on who still has symptoms and who has recovered from their illness. And we're still seeing a fair number of test results come in, but the testing results are starting to decline as well. We're seeing less utilization of testing locally. But if you feel like you want to get tested, if you have symptoms or you're concerned that you may have COVID or you may have come into contact with someone who had COVID, there are testing resources available. And so we can put that in the chat box in terms of the information for testing sites locally, but always visit our website at co.rock.wi.us/public health. And click on the coronavirus information, and you can find all of the information about testing availability in our community. So in terms of the numbers, things are looking good. We continue to see positive trends in terms of case activity going down and our vaccination numbers going up. So we'll continue to monitor those trends and hopefully we see ongoing progress as we move forward here and get into spring. But today I wanted to talk about data quality and some of the reporting that we're doing and some of the issues that come up sometimes when we're trying to report data as quickly as it becomes available to us, and why things change from a day-to-day basis that may not necessarily make sense to members of the public. So what I want to do is just talk through some of the instances where we've had some kind of instances of data cleanup or data quality where we're working on making sure that the data is incredibly accurate, and this is a process that takes a little bit of time. And sometimes when we report daily increases, those numbers may change based on more information that becomes available as we progress through our disease investigation. So I'm on our daily update report that we update on a daily basis, and you can find this on our website. I want to scroll down here and point out one instance of a data cleanup that happened kind of in mid-October. So I'm looking at this graph in the middle of the page, and this is related to the number of negative results that are being reported on a daily basis. And some of you may remember, if you've been following us over the course of the pandemic, we had a daily increase of negative results of over 3,000 in one day. Now, that doesn't mean that 3,000 people tested negative in that single day. What had happened is there had been a backlog of negative results in our statewide disease reporting system, and those were finally cleaned up and cleared out of the system and recorded as negative. Now, this doesn't happen kind of on a daily basis in terms of this data cleanup, but it is an ongoing process, and our state health department is primarily the group that's kind of working on these data quality issues. But there are instances where they may see a backlog of negatives and initiate some processes within their own surveillance systems to make sure that those are counted and reported in the jurisdictions where they're happening. So it does make it kind of look a little bit funny when we're trying to report this on a daily basis. Why are there 3,400 additional negative results being reported on this day? And so the reason that I bring this up is just recently there was some communication from our state partners that there were cases that had been identified as confirmed that were actually supposed to be categorized as probable. And this is based on the technical definition of what a confirmed case versus a probable case is in terms of COVID-19. Luckily, none of the cases, the confirmed cases in Rock County, had been misclassified as confirmed versus probable. But what happened is basically when someone goes and gets a COVID-19 test, they're being tested using technology that's called a PCR test. And if someone comes back positive on a PCR test, that means that they have lab confirmed COVID-19 and they are considered a confirmed case. When someone has a test where they're measuring the antibodies that a person has, this is called an antigen test. And this is a different type of test and a different technology that's used. And these people, if they are tested and they come back positive, they're considered a probable case. There are just some slight technical differences in terms of how we define those cases. But basically, an antigen test is identifying someone who potentially had COVID in the past and has recovered or potentially still has it. If someone does test positive with an antigen test, they will likely be tested with a PCR test. And I don't want to make it too confusing here, but that's kind of the reason why the state had come out and said that there were certain instances where people were maybe classified as a confirmed case, but in reality, they had a confirmed antigen test and not a confirmed PCR test. So that kind of data cleanup and making sure that the data is accurate happens on a regular basis. And the negative test results in Rock County is just an example I wanted to share on this video today of when that has happened in Rock County. Another instance, and this is very common in trying to understand kind of where our COVID cases are with respect to age groups or race or ethnicity groups. We don't always have that information based on how someone tests or when someone tests positive for the disease. A lot of the system is kind of automated where we generate information from a person's healthcare record. But as you know, in healthcare records aren't always 100% accurate in terms of the race of the individual, the ethnicity. Sometimes the age is missing from that record. Sometimes their address changes. Maybe, when they started care with a doctor, they had a certain address and then they moved and they never updated their address on their medical record. So all of these pieces of information are things that we try to work on collecting after the person has tested positive. So what I want to bring up is in terms of when data is reported, and I'm on the state website right now. You can see the URL here at the top of the screen. But basically, when we see cases being reported by certain age groups, you'll see this gray bar here that says preliminary data. And this is just indicating that sometimes we don't always have the demographic information associated with a confirmed case right when that confirmed case is reported to the state or to the local health department. And we have to work to gather that information and go back to those confirmed cases and make sure all of their information is accurate. And in that case, sometimes what we're reporting on is incomplete in real time, and then we go back and clean up that data and make sure that that's included in these types of graphs. So that definitely does happen in Rock County, where we are, we have a certain number of daily new cases that we're reporting on. We don't always know the demographic information with those daily new cases at the time that those cases are reported to us, but we do work very diligently to try to clean up those records and make sure that we have demographic information connected to those cases so that we know where the disease is distributed across the community. We look at factors like age, race, ethnicity, and also residence of individuals to see Are there more cases in a certain neighborhood or a certain sector of our community? And does that influence how we respond to the pandemic? So just wanted to bring those to light on this video today. That's kind of one of the topics, and it's an ongoing process in terms of our data cleanup. We want to make sure that when we're reporting this information, we have, the information going out to the public as quickly as possible. And then we also want to make sure that the information is accurate. So you may see that some numbers kind of go up or go down, and you're wondering what's going on behind the scenes, and know that we are kind of on a continuous basis trying to make sure that our data is accurate and also reported as quickly as possible. So that's really what I wanted to cover today for in terms of our video stream. And I'm just going to take a look at the chat and see if there are any questions that have come through. So one question that we did see was, would you like to see more testing, or do you just see that as a sign of good news in itself? That's a great question. I think the testing rate that we're seeing right now is probably indicative of lower COVID activity. We tend to see more people getting tested when more people are feeling the symptoms of COVID, and we're seeing greater spread in our community. We've seen kind of throughout the pandemic that the testing rate does kind of go up and down. It ebbs and flows based on the COVID activity. Right now, so I guess it is a good sign. First off, is it's good news that we're seeing testing rates decrease. In that's a good sign that COVID activity has come down, and we're seeing that in our confirmed cases. But right now, I think it's really important that we do continue testing people. If you have symptoms, if you're feeling like you may have been in contact with someone with COVID, we do have the resources to test people. And the important thing about testing is that really helps us kind of fence in the virus, so to speak. So if we know where the virus is, if as many people are getting tested that need to be tested, we'll know more information about where that virus is. COVID is a tricky illness because some people can have the virus and be able to spread the virus, but not really have many symptoms or not very severe symptoms. And we've seen this throughout the pandemic where someone may not really think that they have COVID. Maybe they were exposed. They didn't really develop very strong symptoms. It felt kind of like a cold or something like that. And that person is still capable of spreading even if they have very limited or mild symptoms. So testing will remain important as we move through here. And in the vaccination stage, testing is still going to be one of those important tools that we have to prevent the illness. Aside from getting vaccinated, we're still urging people to wear masks. We're also urging people to maintain social distancing, and kind of continue those public health recommendations as we're moving toward kind of getting as many people vaccinated as possible. So appreciate the question. And yeah, hopefully if anyone needs to be tested, they go out and get testing. All right, so I'm gonna check the chat here and see if there are any other questions. Does not look like there are any other questions that have come through. Just a reminder, if you do have questions, you can always reach out to us via social media. And with that, I'm going to close out the video for today. Thanks for joining us. I really appreciate everyone tuning in again, and stay safe and healthy out there. Thank you, everyone. We'll talk to you next time.